I'm Scott McGohan.
And I'm Anne-Marie Singleton.
Now, I think even for our listeners, too, I think what's important is we might be right, we might be wrong. But one thing is, we're not afraid.
Right. And we have a point of view, and I think that people should hear it. And we're unscripted. We just have free reign for 20 minutes.
Welcome to Side Effects with an A. Welcome to Side Effects. I'm Scott McGohan.
And I'm Anne-Marie Singleton.
We have a great guest with us today.
We do.
Our good friend, Wally Gomaa.
Welcome, Wally.
Thank you for having me.
And you are down in you're down in Dallas?
I'm in Dallas, Texas, with ACAP Health in Dallas.
So when we talk about ACAP, kind of unpack that for our listeners. What is ACAP? What does it stand for?
Sure. So ACAP, ACAP, that stands for Accountable Care, Accountable Patient. And it was really a vision that was started back in 2006 by myself and Den Bishop. Den and I are both, employees and shareholders of Holmes Murphy & Associates. And we really felt like the employee benefits industry needed to move the needle a little bit more forward towards what are we doing clinically to help employers dealing with clinical risk and with healthcare costs. So we really formed ACAP Health with a vision of really trying to really change and transform the space that we are in.
So that's interesting. I mean, one is we've been friends for a long time. Holmes Murphy, we look up to you guys. And then
we look up to you guys too.
Well, I appreciate that. But one of the things we talk about, so in the distribution business, which is normally what most people think of as an insurance broker.
Right.
And then you guys are obviously part of C2, which, we collectively brought some brokers. And then your thought process was around, hey, how do we kind of alter the distribution model and look at a clinical-based model, which was the evolution of ACAP? Does that make sense, Wally?
It does. And let me kind of unpack a little bit of what got us motivated to start ACAP Health. If you really go back and reflect what was happening at that time in the industry around things like disease management and wellness, everything was being measured on how many people participated.
Right.
And you had, vendors coming in, sharing a report on performance for an organization's wellness plan and giving scores of an A or an A plus because so many people participated in a health risk assessment or a biometric screening. But when we started to really unpeel some of the data behind it, we saw things like blood pressure, blood sugar, triglycerides. They weren't getting better. They continued to worsen at the same level with or without those programs being implemented. And I think it was really an aha moment that participation does not mean improved health.
It's not equal results.
Clinical results means we're actually improving health. And at that time where we were, we got very concerned that some of the employers that were early adopters of those strategies, those solutions, were going to step back and be pretty disappointed that they didn't see improved health and ultimately financial impact.
It's interesting, too, because you say ACAP began in 2006, and that's the year I joined this industry. So I didn't get to see what you saw before that, right? Before what you saw, Scott, in this industry and what you saw, Wally. So when I came in 2006, I was starting to see what you're talking about is the increase in participation was there, and the studies started to come out in 2006, 2007, 2008, showing increased participation. Then we started to see the studies come out that showed also worsening health and the disconnect between those two.
Yeah, and you look at that disconnect, it's a great point. The disconnect is the reason why I think employers have struggled and been so frustrated over the years with promises that if you just implement this program, implement this strategy, we're magically going to see the trajectory of healthcare trends be flattened. And with those promises and those assurances on return on investment that were largely linked back to a lot of math crimes, we now can step back from this and we look at it and realize that at the real source and the heart of this was that we were not delivering clinical results.
Well, and you guys have invested heavily in people. So it's not only just looking at outside resources. What are all these things coming towards us, and how do we help the employer and the patient? But you have a significant staff, including physicians, inside of ACAP.
We do. We do. It started with, a few of us inside of the walls of Holmes Murphy, sort of incubating an idea with a lot of hope that it could change the world. And it has gone so much further than our wildest expectations. Today, inside of ACAP, we offer a variety of programs. One of our key programs is a program called Naturally Slim. On the surface, sounds like a weight loss program.
Right.
But really what is behind that is a program that was intentionally designed to take out of range clinical lab values around a condition known as metabolic syndrome that leads to things like diabetes, heart disease, cancer. It was really intended to reverse those risk factors. And where we are today is we are the largest digital technology provider in the industry, delivering this clinical intervention to employers of all sizes throughout the United States. Obviously, we've been working with McGohan Brabender for a lot of years as a strategic partner in helping us to take those early ideas and really make them real in the industry.
Yeah, what's interesting about the program you just referred to, Naturally Slim, Wally, is it's a behavior modification program, right? And so it actually changes the way people behave moving forward, which is why it's getting the results that I think that it's had over time. And for me, we went through the program as pilots, right, before we introduced it to our employers. I come from a pretty big Italian family, and I don't think I was ever hungry in my life until I did the Naturally Slim program, right? And I learned the difference between hunger and an appetite. And so and that stuck with me, right? I did that 6 years ago or 7 years ago, however long we did that here. Those little things that you think, well, my workforce knows that, or people are educated, or there's so much information. Unless you're intentional about it, and this program is, it can really change lives.
Yeah. It's, we just look at the most recent data on the obesity epidemic. We're not winning this battle as a nation, and really even more on a global basis. And if you think about what we have tried to do as an industry, it's all been around education and motivation. But what the research shows is that if you ask a person that struggled with their weight the calorie content of a muffin, they're probably going to know it.
Right.
And just telling somebody the calorie content of a muffin doesn't keep them from eating the muffin. Lack of education has really not been at the source of our challenges. It's also not a lack of motivation, even though as an industry, we put a lot of effort in trying to motivate people more. The research shows that people that struggle with their weight, they think about losing weight almost every single day.
Well, even for our listeners, I think one of the things that you guys have been passionate about and what you've taught us to communicate is in regards to if metabolic syndrome is going to cost $6,000 or more per belly button as an employer, this solution can mitigate that by over 40%. This strategy, for the most part, a lot of wellness initiatives are what are you going to do to me? Does that make sense? I'm going to do
That's
this
right.
to you. And people just don't like that approach. And when you think of Naturally Slim, you think of it more in regards to we're going to do this together with me.
Right.
And it's a transfer, as Ann said, of a mindset in regards to my respect for food, my respect for myself emotionally. Mm-hmm. And it gives people because they do this alone. So you're not in a room with a crowd of people. You're not disclosing all of these different habits. You're actually getting a better understanding of your respect for food. That includes sugar, fat, things that, quite frankly, I didn't know anything about. And I did it probably 8 years ago.
Yeah, probably the same time.
And I think total, I started exercising. I lost 50 pounds. I've kept it all off. Mm-hmm. Now I love ice cream. I love ice cream, and I love pizza. But I also have a new respect in regards to moderation. So what does moderation look like in Scott's life? And we've seen significant results in the Naturally Slim program.
Yeah.
Not only in claims cost, which that's a wonderful thing to happen, but I think the thing I love about it the most, it gives people hope. It gives them a new hope. And it also gives them a way to where all of a sudden they're not pinging up and down 15, 20 pounds.
Right. The keep
Over
off
time.
rate. The keep off rate is amazing. And one thing you said just a minute ago before we started to talk about this is the folks that you have there at ACAP. And so you mentioned this is not a motivational program. This is not, an education program, so to speak, in terms like we would know education. But this is a program developed by clinicians and also administered by, Marcia, who does most of the talking, is a clinician. And so this is steeped in the medical field, right? And understanding how this works for people in their lifestyle.
Yeah, it's a very,
Hey,
Hey, your phone's
you're
ringing.
popular.
Hey, that's your
Yeah.
mom. You need to pick that up.
we'll let that one go to
There you go.
voicemail. So, if you think about, and I appreciate your comment on the clinical aspects of this program, it's really important. I always say this is not wellness. This is really a clinical counseling, clinical treatment program, to the extent that for many organizations today, the way that they fund for the cost of the program is really through medical claims. This is covered under the Affordable Care Act's definition as an essential benefit and covered as a preventive care claim. That has allowed employers to really capture this in the same mindset as you would getting a colonoscopy, a mammogram, or other preventive care services. It's designed to prevent disease. And if you kind of lift it up at a big picture level, if we can reverse metabolic syndrome or obesity-related disease, it's really two different names for something that overlaps considerably. Mm-hmm. We really start to impact a large claim report. And as we all know, the difference between an employer having a good year in their medical claims or one that's not so good is really what happened around large claims. We've learned how in a matter of weeks to use technology so that at the click of the button, we can reverse clinical risk in a very clinical, quantifiable way. I like to say the blood doesn't lie. You see it in the blood data.
Right.
We're now taking those learnings over the last decade and we've expanded it into other clinical areas that we feel have been gaps in the industry.
Well, and I think also what you've done too, you back it up with science. Fair?
That's true.
You don't sell food, right? You're not selling anything. And it's also, it's psychological warfare as well. So you're addressing that from a completely different angle. So as we talk about Naturally Slim, what are some other things that ACAP's doing that you're really proud of?
So I always start with a definition of the way we think of the employer's world. Healthcare cost is a complicated item, and we try to boil it down into the really simplest equation. So get your math algebra ready. Price times use equals cost. Naturally Slim has really been about trying to affect the use side, the utilization of healthcare. By doing things that reverse risk to the point that we don't have certain claims from happening. We've lowered the use. Right after we launched Naturally Slim to the industry, we got really excited about some work coming out of an organization also in North Texas called Compass Professional Health Services. They were really the pioneers on what do we do that when a claim does happen, we make sure we get it from the provider that's going to deliver that care at the best possible price and quality. And again, if you think about the mindset of where we've been as an industry, it's always about go in network.
Right.
But where you go really matters by clinical episode. And so this is about a 10-year-old initiative for us today. It has been proven to show that if we can have a patient go to the right provider at the right time for the right diagnosis, we can get such better outcomes and better unit cost as it relates to the actual treatment of a patient. And if I go back to our definition of ACAP, AC, accountable care, are really the kinds of things we do with programs like Compass. AP is really the kinds of things that we do around how we have helped the patient be more motivated around their health.
Yeah, and we appreciate all the work you've done. We've had great success, I think, with our clients in utilizing both of those programs to help them control that cost. One thing you said that I think employers that are listening to this need to think about is we're avoiding future claims in many of this. And so that sometimes is a difficult thing for a financial person to get their mind wrapped around in terms of we're claim avoidance. We're reducing future claims versus eliminating the claims that are happening right now. We can't eliminate those that are happening right now. Therefore, the compass where we can say we're connecting you with the right provider at the right cost at the right time. And so it really has to come at that from both sides.
It does. It does. If I kind of think about our insurance industry more broadly, and you think about the property casualty world, the property casualty world, especially with workers' comp, they look at risk related to employee injury. And if there's a slippery floor, let's say at a facility, that employees keep falling on, they might tear out that floor and put in a more safer floor for individuals to walk on, so there's less slips and falls and workplace injury.
Right.
I think one of the things too, when you think about what we're talking about, is there's a perception in our industry that there's an app for that. And when we're talking about human condition, an app isn't going to fix it. So when I think of Naturally Slam and I think of Compass, what you have is it's backed by science. You have people, right? So it's humans talking to humans about real issues going on. And let's face it, a consumer probably doesn't want to talk to an insurance company.
Right. It's scary.
And there are good insurance companies and there are bad insurance companies. And there are insurance companies that really care. But for the most part, the consumer wants, that's why I think we've been successful. McGohan, Brabender, Holmes Murphy, we care. And we're unbiased. So we're not lined up against any one entity. And it's one of the reasons why we've really appreciated our relationship with ACAP is, you guys are thinking at this from like 60,000 feet. What else is out there? And we look to you to say, hey, Wally, Den, how can you guys help us mitigate this risk inside of our customers? When we think about the future, so you think about ACAP and the strategies, where we started, where you are, what's next? What's next in Wally's world?
Well, we've been at Wally's world. That's scary. We've been at this for a decade, and one of the things we've learned together, really, between McGohan, Brabender, and Holmes Murphy, is I want to go back to the comment you made about there's an app for that. These are not silver bullets that you just implemented and things magically happen. It requires a very thoughtful strategy for how it is incorporated within an organization, and every organization is different. I know one of the things that we've partnered on is helping clients really go through and assess what do they believe their role should be and what are their core beliefs as it relates to their role in improving employee health and affecting healthcare cost in the equation that I described. That requires advisors that don't just want to implement any program and expect it's going to solve the challenges,
Right.
but really think about it that is in a way that is culturally sensitive and aligned with an organization.
And you have a lot of Fortune 500 companies that have stood up and said, I want that.
There's no question.
Yeah, like a lot.
There is. So ACAP, we work with organizations that really fit within the industry size of that organizations like McGohan, Brabender, and Holmes Murphy work with. One of the things that we've been fortunate is to work with some of the largest Fortune 50, Fortune 500 companies. We work with large state governments. We work with federal employees. And at the end of the day, every organization, regardless of size, industry vertical, whether they're blue collar, white collar, gray collar, they all have a belief set. And first understanding what that belief set is helps them to decide how we're going to bring programs forward, because it's not a silver bullet that you just implemented and it's just gonna solve the day. So I really say that as a preface to your question on kind of what's next. We are looking at a couple of things right now that we're really excited about. One is if you really step back and you look at the data and what's affecting employers, it's hard not to look at what's been happening with pharmacy trend and specifically with specialty pharmacy trend.
Right.
And when you drill down and you look at that a little more closely, so much of it is related to digestive disorders and digestive disease. Things like Crohn's, ulcerative colitis, IBS, very high specialty pharmacy spend. I always, tell our clients, just turn on network television, watch the commercials at night, find out what the pharmaceutical commercials are, and you'll know where we should be spending our time and our energy. We're taking what we've learned on digital technology to reach the masses at the click of the button, and we're now looking at the digestive category as an example. Again, that really is a targeted intervention, and after the years of delivering different targeted interventions, we're now moving to even look a little further downfield to say, if you assembled those interventions and you really re-engineered the way health benefits and health insurance is designed from the ground floor up, could you actually create a health plan that would disrupt and transform so many of the things that we've struggled with? And we're currently working on what we think will be very transformative in the way health insurance is delivered to employees and the way providers interact with the insurance industry. We are excited in the next few months to roll out what we call Fix Healthcare, which is really an insurance program designed to sort of build everything from the ground floor up the way we should have done it from the beginning.
That's pretty exciting. That's really exciting.
Yeah, and even for our listeners, I mean, I know we have a lot of people. I mean, they've got businesses to run. They're trying a lot of different innovations, and then we get super excited about this industry, and they've got some of them are like, "Are you kidding me?" However, what we are talking about is, quite frankly, and maybe we'll ask you to come on next time, and we'll talk about the details around Fix Healthcare, because it is Yahtzeeing the current methodology. And it's actually going way, way, way back to the future and collecting a lot of the things that worked before and resetting the field and the players on the field. I've said even with pharmaceutical, we've gotten to a bad place in America when we've created an ad for constipation for opioids. That's a bad place to be in this country. It's a terrible place to be in this country.
It is.
And then we have people that really care about, hey, how do we jolt? How do we shift? How do we change the distribution methodology? How do we change the payment methodology? How do we add more transparency and get the consumer on the field? And what you're doing is just really, really cool stuff.
It's also pretty simple, right? If you look at any consumer industry, we go online, we evaluate things based on price, we evaluate things based on quality, and as a consumer, we make a decision based on all the information that's been provided to us on, are we willing to spend that amount? Healthcare, because of the plan design complexities, we joke all the time that, people don't really know what coinsurance is. They call it coin insurance. It's just too complicated. And individuals at the end of the day just want it to be simple. And if we start with a white piece of paper and instead of trying to modify things on the fringes, you just build it the way any consumer industry is built. It works great between the supplier, it works great with the consumer, and it just works simply. And it just fixes things. And that's why we call it Fix Healthcare.
It's a really good point. I think, again, coming into this industry in 2006 and looking at it, it has just been not without, a good heart and good effort from a lot of people of trying to fix healthcare, right, or to modify or change it. But we're just making tweaks to a gigantic system that's been in place for a really long time. And it's not enough to move the needle. It's not enough to carry us forward. And so that's why I'm really excited about what you guys are getting ready to roll out.
Well, and it's brand new.
Go ahead, Scott.
I think one of the things, too, that we would like to do is we'd love to bring you back on Side Effects. And one is, thanks for your time today.
Thank you.
Thanks for caring about this business and a completely different mindset than what I think most people think about. And then thanks for backing up this with a lot of resources. Physicians, specialists, people, belly buttons, massive strategy and technology.
And data.
And data, and a lot of data. That, quite frankly, it matters. And so if our listeners want to get information around ACAP, we can put some information on healthierbirthdays.com. But I'm assuming you've got a website, you've got information out there about what you're doing.
Yep, a nice blog site. I looked at your blog. It's very nice.
Yeah. Well, obviously, I'm personally available. But please do visit acaphealth.com, acaphealth.com. A great way to just get in contact with us. We will be happy to share more about some of the ways we're trying to change the world. It's a mission for us that is bigger than just reducing cost. It really is around trying to save lives.
Well, and we know you because we've met your people, and you guys care. So thanks for putting a dent in healthcare, and hope you come back real soon as we talk about fixed healthcare, which I'm really excited about. And have an amazing day.
Thanks, Wally.
Thank you very much. Everyone have a healthy day.
Thanks for listening and opening your mind. If you're interested in learning more, you can reach us at scott@healthierbirthdays.com.
Or Ann at healthierbirthdays.com. We hope you'll join us next time
on Side Effects.